This episode is dedicated to a conversation with Avishai Ben Tovim, the CEO of MDI, a company established in 2019. MDI developed a risk analysis system for polypharmacy patients that aims to handle these complex patients and create accurate clinical recommendations for treatment optimization and risk mitigation. Despite increased efforts in the field of adverse drug reaction prevention in the last decade, there appears to be an increase in drug-induced hospitalization and mortality rates. The medication management platform developed by MDI scales up the process of drug adverse event prevention and helps patients, physicians, and payors to avoid the clinical and financial consequences associated with drug-related adverse events. Overall, the company mission is to enable value-based care through focus on clinical quality and cost reduction. In this episode, we discuss the solution they provide, the validation they generated, and their future goals.
So because we understand that physician cannot do a personalized treatment manually, and that the existing technology is available for them, just bombard them with one-to-one drug interactions, which are inefficient. The CMS and health plans understand that it's their responsibility to run their own medication management programs through their pharmacy teams or through their care management, and try to prevent these problems that they are completely preventable, and they are paying for these unnecessarily hospitalizations and RX costs. And this is why one of the main programs they are running is the MTM, Medication Therapy Management Program, which is actually mandated by the CMS. The problem with this program is that it's focusing mainly on adherence and education. So from the get-go, first of all, it aims for a very small subset of the population. So in order to be eligible for this program, you need to take more than $5,000 on medication costs per year and have a few chronic conditions. So it actually touches a very small population compared to the relevant population for comprehensive medication reviews. Second, even out of those eligible, very few are actually going to complete the process, which requires patient engagement. Even the one that's able to get on the phone, still the quality is very poor because the analysis is done on the fly. There is a big variation between different pharmacies because of their time, experience, and attention. And to do a really comprehensive medication review, it takes 75 minutes. It's impossible to ask them to do it in 10 minutes conversation. So because of this poor quality, and because these programs measure themselves only on completion rates, which they are part of the STAR metrics that the health plans are being measured on, and not really about outcomes, the end result is that many of these recommendations are actually being ignored by physicians. And therefore, the impact of these programs is very, very low compared to the potential impact. And that's exactly what MDI actually solved.